Welcome to the podcast. My name is Dr. Tom Washevsky, and I'll be your host for this ongoing OAA podcast series. Just a bit of background about me. I've been involved with orthokeratology for more than 20 years, have been a member of the OAA since its inception, have served on the board of directors for the past 4 years, and the co-chair of the Mentor Committee, as well as the co-host for the Vision by Design Bootcamp. The last few podcasts, we talked mostly about myopia control. I thought I'd like to change things up. So we're going to talk about practice management, and specifically how to implement and then develop a vibrant and ongoing Ortho-K practice. And I thought no better way to do that than to have one of the top Ortho-K practitioners in America, Dr. Nick Despotidis, join me. For those of you who have attended Vision by Design, I'm sure you've heard Nick speak, and perhaps you've attended his Supercharge practice. Nick has a lot of credibility here, simply because he has been doing Ortho-K for about 20 years. He has what is currently the largest, or if not the largest, certainly one of the largest Ortho-K practices in America. He has written a book called My Children Are Nearsighted Too, and that's in addition to all his fellowships with COVD and the American Academy of Optometry, as well as the Orthokeratology Academy of America. So Nick is going to be my co-host, if you will, for the next couple of podcasts. Nick?
Thank you, Tom. Rather than lecture on practice management, I've always wanted to interview practitioners who've embraced Ortho-K and have run with it, and have encountered a lot of difficulty doing that, because a lot of times when we lecture about any particular topic, I think we oversimplify it to motivate practitioners to get involved with this submodality. So then, rather than hear about my practice and what I've done, I said, let me interview practitioners that I've known for a while that have made a commitment to Ortho-K. And Eileen Lo came to mind very early in the process.
What can you tell us about her and her practice?
Dr. Lo attended my first Supercharge Your Practice in 2006. And I remember she came with her husband, and she was committed back then. And she was doing it back then. So this is a practitioner who is doing it and has really gone with it. So I wanted to speak to her, see what challenges, what successes she's made, and really for all the members to learn from her experience as well as my own. I want the listeners to focus on a few particular things that I found very, very informative. One, she runs multiple locations. Two, she allows for a consultation for patients interested in Ortho-K. Three, she practices in a very competitive environment, extremely competitive, more than mine, more than most. But she takes the time to justify her fees with her patients. She discusses very practically how she does that. She doesn't discount her service. She loves what she does, and she feels she's making a difference. And lastly, she feels challenged by Ortho-K, and she continues to feel challenged probably 10 years after she's doing it. And that's why I chose her, and I think really I hope the listeners really benefit from what she has to offer.
Well, that sounds great. Well, with that, let's hear from you and Dr. Eileen Lo.
All right, so let's get started with, why don't you tell me a little bit about your practice, Eileen?
My practice is in the San Francisco Bay Area. I have 2 offices in Oakland and 1 office in Fremont. So 3 practices.
That's great. Do you offer Ortho-K to all 3 practices?
Yes, we offer to all 3.
Okay. So tell me.
And a lot of my patients are Asians,
right.
Chinese, Indians, Vietnamese, Koreans, so mostly Asians, and some Caucasian patients too.
I have a question for you. Do you think it's something that has to do with the high degree of myopia in that population, the Asian specifically?
Certainly, yes.
Do you also think it has to do with them viewing myopia as a disease?
Yes, the parents are very, very concerned because most of the parents have high myopia, and they have LASIK done, and then many times they really think it's a condition that is really impeding the life. They really want to change it for the children.
Yeah, I find the same thing, but I find my Caucasian patients also that go for orthokeratology or cornea reshaping view myopia as a disease also. So they seem to have the same personality traits as people of Asian background. And I was wondering if you found the same thing.
I have less Caucasian patients with high myopia.
Okay.
So possibly, if they view the condition as a disease, they would certainly approach Ortho-K as a means of correcting the condition.
Right. I guess what I'm saying is some of my patients who have high myopia, they're not interested in Ortho-K because they don't view it as a disease.
Yes.
It has to be a certain personality trait to do it.
Yes.
I don't think this is an
you.
Asian treatment. You know, I've been doing this like you a long time. I'm going on 20 years, if you could believe that. And when I look at my demographic, there's a high degree of patients of Asian descent interested. But the smaller percentage, they seem to really view it the same way as a disease. And they're just as nervous, and they're just as anxious when it comes to this technique. So I don't think this is an Asian technique per se. I really do think it has to do with a very meticulous parent who is very concerned, who's afraid that their children's eyes are going to get worse.
Yeah, I agree with you.
Yeah. So tell me a little bit about how long you've been in practice now. You have 3 locations.
I've been in practice since late 80s.
Okay.
And Ortho-K was not mentioned too much during my education. So it was considered as not effective. So I did not get too much education about Ortho-K. But of course in the 80s, the lenses were not as good, But I have been doing a lot of RGP lenses as myopia control until the 1990s when I was approached by a parent to provide Ortho-K for her daughter because she heard from a friend out of state.
Right.
So then I was trying to search for information. So I contacted Steve at Context in California. So he helped me through this case of fitting and also a few more cases. So that's how I get along with Ortho-K. And
then it slowly blossomed from there.
Yes. But at first I had a lot of trouble, understanding the techniques. And I went through so many designs. And so whenever a manufacturer has a new design, I went for the seminar and I got the fitting set. So I think the FDA approval of the procedure is a great help for me. Yeah, I think it blossomed a lot from the CRT being approved by the FDA.
And so you fit more than one design, I'm assuming.
Yes, I did. Mm-hmm.
And I do the same thing. It sounds like I started doing this in the early 90s, but I only got serious with it in the early 2000s when it became FDA approved. But it seems like both of us were very interested in myopia control, even prior. And I think this is an underlying theme. You can't do this technique if you're just doing it because you want to make more revenue. You have to have an underlying desire to help stabilize myopia, especially in children, I think.
I agree with that. So, but the FDA approval of the procedure is a big, how should I say it, a talking point with the parents. So before you try to explain the procedure, and many parents are skeptical. Many parents have not heard about the procedure. You could say, oh, it's such a great procedure. You really helped your kids. By having the FDA approval of the process really helps me getting along with this part of the practice.
Even to this day, 10 years after FDA approval?
Yes.
Okay. So out of these 3 practices, we met again in 2006. You were doing it before then. What drives you to continue doing it? Because I know, like you do, this is not easy. It is tough work.
Right.
Dr. Jones, one of the people I interviewed earlier, said it's not for wimps. Private practice is not for wimps, and Ortho-K is definitely not for wimps. What has given you the impetus to persevere?
I got a lot of satisfaction fitting orthokeratology lenses, knowing I could change lives, like a kid could see so could see 20/20 without wearing any glasses during the day, and the face blossom, the face glisten when they could do that, And also, parents appreciate your service so much, and I have many parents thanking me with tears in their eyes, I have a kid that is like -6 when he's 8 years old, so the mother practically cries in my exam room. What can you do for my child,
Right.
So now that he's seeing very well without glasses, so very active in school doing sports. So these are example of of cases that really motivated me to continue to provide the service for the patient.
So,
and also is I think professional is challenging for the fitting of the patients. So I think it gives me satisfaction to be able to provide the fitting, to get the good outcome.
I agree. It makes you feel professional, doesn't it?
Yes.
Instead of you saying,
not just doing refraction.
That's right.
That everyone could provide, yeah.
Instead of you saying, I'm sorry, your child's eyes got worse, it's genetic, I'm going to make them just a little bit stronger, let's see you in 6 months or a year, you're actively trying to do something.
Right.
And in return, parents are thanking you and crying, and because I get the same thing. It's thank you, doctor, for helping my child, because a lot of doctors didn't do this or didn't want to do this.
Right. And I have a lot of referrals from patients with good outcomes. When they could see so well, they tell everyone in the sports group, in the class. So, it's a good revenue for our office too. And not to say that it's not.
Absolutely. But you earn every bit of it. I want to stress that. At least you're working hard, very hard, but you're getting reimbursed for your time and effort. Sometimes we prescribe progressive lenses or soft bifocal contacts, and we don't get reimbursed for the time and effort we put into fitting these people.
Yes.
At least with Ortho-K, we're being reimbursed for our time and effort if you are charging appropriately.
Right.
Let me get to the crux of it. You've been doing this a long time. You're doing it for professional satisfaction. You're doing it because you can help the patients. You're doing it because you're technically challenged. What happens when you get challenged by the competition? Because you and I, knowing each other for a long time, you've said to me, hey, Dr. D, what do you do when people say, I can go to the doctor across the street and get it for less money? Or I noticed, you said FDA approval. This is the challenge I find. I spend the half of my consultation, like you do, explaining that they're FDA approved and safe in my hands. And then the patient goes from concern to confidence, but then they want to treat it like a commodity, saying, well, if you're going to fit this lens, the doctor across the street fits it for half the price, 10% less. Do you encounter this?
Yes. More and more, I have patients approaching me and my associates and trying to compare pricing and try to bargain for a reduced price for new fitting and for renewal fees. And also they would say, my child does not need renewal every year. They could keep the same lenses for 3 years. Some other practice does that, Yeah. So I do have challenges like that.
Is that one of your biggest challenges? Or do you have another big challenge that you're currently encountering now with your Ortho-K practice?
Another challenge is to have the right staff helping me, the nuts and bolts of the fitting, of the training, scheduling patients. So that also needs to be addressed.
So your two biggest challenges in making your Ortho-K practice grow to one of the biggest probably in the country is staffing.
Yes.
And competition/price. It's not really competition, it's pricing, isn't it?
Yes.
It's
right.
So let's take those two aspects, because it's not only you, it's everybody listening in. Let's take staffing first. How have you combated that, or have you been able to combat staffing and training and things like that?
I have tried to dedicate 1 to 2 personnel
right.
that have the right motivation to help patients. So I try to delegate those patients to do training and also to follow up the day after dispensing. and to send them emails to let them know they could contact us anytime through email or texting if they have any concerns. And of course, to our patients, I mean, to have all the staff enthusiastic about this procedure, so that they could mention to all patients about that we do provide the service.
And how's that been going? What happens if that one staff member leaves? Has that happened to you?
Actually, that's pretty recent problem, because one of my staff is resigning because of relocation.
Okay.
So I have to think about which other personnel I could use for the same thing.
One of the things that I did, you met my one staff member who I depended on a lot for her for the first almost 5 to 10 years. And she helped me build it because she was my go-to person. We have a large practice. And then she left for reasons beyond my control. So I got very nervous, but I want to give you some confidence that if you write down, before this person leaves, write down just in a checklist what they do on a daily basis. I would recommend training now 2 people, because I trained 4 people after one person left. Mm-hmm. And it has worked out amazingly well. So what I found, it's not necessarily the person, it's the procedures. And if you document, this is how I want to correspond with someone after the INR the next day. This is how I want the emails to be responded to. This is how I want to present the fees. This is how I want things done. If they just write it down, you kind of make it still Dr. Eileen Lo's program, and these are just an extension of your hands, which has worked very well in my practice. If the systems are tight, you don't have to become so leveraged on one person. That really helped me a lot. I have someone as young as 23 helping me in the program, and as old as 40. And they're equally effective, even though they differ in experience and maturity. They're equally effective. So that's something to consider.
Yeah, I've attended your webinar last year, and since then I have starting to develop a system. Yeah. And has been working.
It's hard to do. It's a constant and never ending, but it's the only way to continue growing. Because when that one staff member left, even though I teach practice management, I was nervous because you see how much we depend on them. But it was fine. As a matter of fact, this year was the first fiscal year without this one person. We did better than ever. But I was really nervous, just to be honest with you. But as long as your systems are intact, you're fine.
Yes.
Let's talk about the competition pricing. How have you dealt with it? And I think we'll close on that, because everybody who's listening to this, if they haven't dealt with it already, they're going to deal with it. It's, I like you, Dr. Lo. I like coming here. My friend referred me to you, but I can get it less expensively here, or my friend says it's less there, or I have another friend. How do you deal with that?
I try to, we offer a free consultation for patients that are interested in the procedure. So I invite both parents and the child into the exam room. Okay. So first I explain to them how much myopia or how much prescription the child has, and why is it a problem, like there's so much change within a year. So first I establish why the child would need Ortho-K, and I would show them the topography maps and what I am actually considering when I'm setting a price levels. I would say, the cornea is small, I have to use a smaller lens, or I would say, your child has this astigmatism, or I would, things like that, the complexity of my consideration. Right. So they would know that the price I set was not just, just taking it just from the book. It's actual consideration of the complexity of the fits. I would try to build a rapport with child also. The parent has a big concerns whether the child could actually put on a contact lens, or whether it's going to be painful for the child, or whether it's going to have a corneal ulcer or something. So I would explain to the parent the steps I would take to prevent that from happening. And then I would tell the parents I have a lot of experience with young children, and our staff have a lot of experience with young children. And of course, we explain the contracts and stuff like that. So by doing this consultation is a great help to explain why we set this fee this way, and to have the support, to have the trust from the parent and the children. I guess would justify why I'm setting this fee. So in that, usually it's okay.
I can't agree with you more. Do you ever lower your fee when they say, Dr. Lo, I want to come with you. Can you give me a lower fee or something like that? Do you conform to that at that time, or do you stand strong?
I stand strong. We do have a 10% off when they pay one time.
Right.
Without a payment plan. So I said, yes, we do have a discount plan, but this is it. So besides that, I would not offer any other bargaining. And
I can't agree with you more. I've really interviewed a lot of people. I've been doing this a long time like you. No one is quote unquote successfully happy with an Ortho-K practice by discounting this. You just can't. And it seems like you take a lot of time developing a rapport with the parent and the child to get their confidence in you. And then you allow them to make that decision. If they want to go somewhere else for less expensive, they know that they are going to get less expensive treatment. And one last question. Do they ever come back? Let's say I do decide not to go with you. And I go to someone because my friend says, oh, go to Dr. X across the street. They're less expensive. Do they ever come back to you? I'm just curious.
Yes, many times they have shop around, and then they would call back and say, oh, actually, I wanted to go with you.
Yeah.
Yes.
And I get that also. How about if they went and got fit by someone else? Do they ever come back to you?
I don't remember particular patients, but I have patients coming from other office that actually came to me to say, actually, we're not getting great service from the other office. Yeah. They're being ignored, or they are not addressing problems for the kids. Yeah, so they came to me.
And I get that
back.
A lot.
Yes.
I get that a lot where we went somewhere else, my child's not seeing well, we're not getting the care we think, we're going to come and start all over with you. It's very, very, very important, I think. So let me close it on this. What success, besides the professionalism, making patients happy, the financial aspect, what keeps you going? Why, after so long now, over 10 years of doing this, what drives you? Is it all them combined? What's that thing that really keeps you going during the hard times?
I think it's all of them combined, and also knowing that you could actually change life and helping a patient. They would not end up having to do surgery or having retinal detachment.
Right.
All these complications from myopia really keep me going.
Right. I don't know if you ever get this case. I get some cases that decide not to do Ortho-K, but to stay with me.
Yeah.
And then they come back a year later, and I'm amazed that sometimes they double in myopia in just 12 months.
Yes, we have many cases like that, and we're just like, we have told you about, this last year. You should have done it last year.
And do they end up doing it?
Yes.
Yeah.
Yeah. So it's also planting a seed in the patients. So you just keep on telling them every year, and then eventually they will say, yeah, I should have done it, but I'm going to do it now.
That's great. That's great. Eileen, I can't thank you enough for doing this. We're both talking. You can hear some buzzing. It's Monday morning, and we're both met early to tape this conversation. I can't thank you enough. I'm very proud to know you. I really am. And just hearing you, you've motivated me to have resilience, if you will. And I think a lot of people listening to this are going to benefit just from your experience. So I wanted to thank you very much.
Same here, Dr. D.
Thank you.
That was great, Nick. I really appreciate all the time that you put into doing this interview with Eileen, and I think it's going to be really helpful to a lot of our listeners.
You're welcome.
You've been listening to the Ortho-K podcast, brought to you by the Orthokeratology Academy of America. Go to www.orthokacademy.com. The music for this episode was done by Meredith Wilson and is used with permission.